Hi, my name is Lauren Bedrock, and I'm doing my family theory presentation on the family health system model. I will be discussing the key concepts of the theory, definitions of family health, environment, and nursing, how the theory has been applied to nursing practice, and 2 research projects guided by the theory. The family health system model assumes that family health is systematic and process-based and includes interactions of family and individual processes. The health of one individual affects the entire family. Changes in health require a change in other areas of daily life, such as member roles and chores. The family health system model provides an integrated approach to examine family health by considering the dynamics of families in 5 realms of family life, which include interactional, developmental, coping, integrity, and health realms. By considering all 5 realms, the nurse can examine family dynamics, strengths, and concern. The goal is to use the family strength to improve health and function for both the family and the individual. This figure shows the 5 realms of the family health system model, what each realm entails, and how they all come together to form family health. The definitions of nursing, family, health, and environment are important to understand for this specific theory in order to see how these roles are implemented. First, nursing is described as a client advocate to assist the family to implement needed adjustments and adaptation in order to facilitate family symptom management, individual and family growth, family understanding, and promotion of improvement in family health. The family are experts on their own life who have shared beliefs, rituals, and routines relevant to health and illness. Health and environment were not specifically described by the theorists, but were implied factors in family health. Health was described as a dynamic state of obtaining physical, psychological, social, and spiritual well-being. Environment is a social and physical background that can be manipulated to enhance a healthy lifestyle. Evidence-based practice has shown that the family health system model has been used to improve health and functioning of family units. In Anderson and Valentine's Wisconsin experience, a family nursing center was established to assist families to cope with illnesses such as cancer, cardiac conditions, chronic pain, dementia, and diabetes. The providers performed comprehensive assessments using the 5 realms of family health, and individualized strategies were implemented with the family based on their needs. Interventions were also focused on communication between the family and healthcare providers, identification of community resources, and helping the family with the healthcare system in general. Families were interviewed after their visit and showed improved coping skills, improved ability to communicate amongst each other, and increased understanding of the illness. The results of the experience over a 3-year time period showed families benefited from family interventions, and the family health system model has been the basis for advanced practice nurses at the Family Nursing Center since the experiment was developed. In a review by Austin and Pearson that studied 17 different research studies, family system nursing interventions improved cognitive, affective, and behavioral responses by the family. In regard to the cognitive domain, the system nursing interventions improved understanding and capability of the family regarding the illness and enhanced family coping. The affective domain showed more care between the individual and the family, improved family emotional well-being, and improved individual emotional well-being. The behavioral domain showed healthier individual behavior and improvements in interactions within the family. It was proven that individual patients benefited from family-based interventions rather than individual focus, and relationships between the patient and family member improved. The responses of multiple families after participation in the family system nursing interventions transferred to the interventions led by trained nurses in the hospital. This challenges the idea that family system nursing interventions lack empirical evidence. The review showed that these interventions, when incorporated into nursing practice, improve family health and outcomes. The first research project shown here incorporated the family health system model to provide better care to families with children in the pediatric intensive care unit. There have been more than 50 nursing studies that show family stress is an important clinical factor in healthcare and is a central nursing responsibility. Management of stress is critical to the delivery of patient care, and improper management of stress can lead to decreased trust, support, and communication between the family and the provider. Also, evidence has showed that nurses lack intervention skills for assessing family needs and need for support. Based on this information, a family system nursing intervention was created to improve nurses' knowledge to provide better support to families. The family system nursing intervention that the researchers created is a 30-minute therapeutic dialogue which includes open-ended questions to explore family roles and keep the interaction focused on the family as a system. The family health system model was used as a platform for the intervention, using four realms of family health, which included integrity, maintenance, coping, and health-related interaction into nursing action that could affect family stress. 60 high-stress families were chosen to be interviewed, whose children were in critical condition over the course of 3 years. After implementation, a post-test was administered 3 days and 3 weeks after the intervention to test efficacy of nurse-family relationships. The results showed decreased family stress through specific interventions that encouraged family participation in caring for the child, and with modifications, this study can be used in other nurse specialties. This study further proves that we need to treat the family as a system and not just the individual. The second study shown here used a family systems approach to improve understanding of family stress processes and examine different parental interactions. There were 340 families interviewed, with each parent rating their financial stress and parenting stress. Then the parents and adolescents rated the parent-child interaction. The results showed that financial stress negatively impacted parental stress. The parental stress was associated with less open parent-child communication and more problems with the communication as well. Both of these factors are associated with adolescent behavioral problems. These findings are consistent with the family systems approach, that family is a systematic and process-based, where problems in the family system, and in this case parental stress and financial issues, have negative effects on other family members. These findings further prove the importance of treating the family and not just the individual. In summary, the family health system model can be used to perform a comprehensive assessment to identify family strengths and concerns to improve overall health. I can do this by first creating a family genogram and ecomap to gather family information and then build upon this information using the 5 realms discussed earlier. This will help me to look at the family as a system to address concerns and help them improve their overall health. Thank you for listening. I hope you have a great day.